Hi everyone, so I am back on this channel on YouTube with another video, and today in this video I'll talk about something which is very close to my heart, my profession, my purpose in my life, to be a doctor. And I have seen a lot of youngsters have asked me this question, right from students in school, right from students who are pursuing their MBBS, what goes into becoming a good doctor? So first of all, we need to understand what does it mean to be a doctor. I would initially say that please don't weigh your success with the material things that you sometimes correlate it with. I have seen people would say, how much does a doctor earn, how much does a surgeon earn, or how much does a radiologist earn. It is I want to initially say that whatever you will earn in life, or your houses or your cars, are going to be the byproduct of success. They are not success in itself. What is the true privilege of being a doctor is that we are able to understand what goes into the human body in normalcy as well as in disease. And I think it's a privilege that human body is such a divine creation where it is so difficult to understand that there would be so many processes happening together in our body. There would be brain would be firing at a different wavelength, and there would be something happening in your heart, and everything is happening together. It is such a privilege to know about all this. Second is that when in disease, especially in your loved ones, you are able to understand what is going on, and as a physician we are able to pass on this privilege to strangers. And that is what makes this profession special. We are able to touch many lives. We are able to, have an impact. And I call all the medical aspirants and medical students as high impact seekers. Because when I was at the school level, I had little clarity about what medical career would be. But I always wanted more impact out of life. I always wanted to do more in life. I wanted to touch more lives. And in this profession, we get that satisfaction that this is like, you would always see people talk about passion, purpose. In medicine, you get both of them together. Because when you're doing your job well, like suppose you are passionate about neurosurgery, so you are following your passion by operating on somebody's brain, but you are serving a purpose by helping him and his family members. It's a beautiful profession. And how to be a great doctor? I think there are 3 components, and those are the components which have helped me in my life, and I want to use this medium to share it with all the future doctors. Number 1 is knowledge. I have actually seen this question more recently, where a lot of students have been asking, do we need to read books? Or I see a lot of resident doctors asking that which specialty should I pursue where I will have to study less? Answer, unfortunately, is there is no such medical specialty. You will have to study. If I look back at all the decisions that I have made in my life, one of the most important decisions was to read good books. I am an avid reader. I have been always reading good books right from my first year MBBS onwards. I read Genong, I read Robbins in my second year, I read Park's PSM, yes, although some of you may not like the book, but I loved it. I've done a mix and match of Harrison's and Davidson during my final year. I've read good books and I'm proud of it. Now you might say, till what time do we have to study as a doctor? The answer again is lifelong. We will keep seeing, and I've seen in my own life, when I started my residency in radiology, it was more about X-ray, special investigations, ultrasound, Doppler, CT. And by the time I was finishing my MD, it was more about MRI. And by the time I was finishing my senior residency, it was also about PET scan. So we have to continuously learn, because technology will change, the drugs available will change, treatments will change, guidelines will change, and even the diseases change. We never had COVID in the past, but now it is a well-known disease, and we as a doctor, we need to update ourselves. So never ever underestimate the power of knowledge in medical profession. There will be people who will tell you shortcuts, there will be people who will tell you that you can do it without studying, but I am telling you, please keep it in writing. It is a branch where knowledge that you have will guide your hands. And that takes me to the second part. The second part of being a superlative doctor is skills, hand skills. But how do you acquire those hand skills? By practice. You need to do more, and more skills you have, more skills and more a practical knowledge you have, you are able to do better as a doctor. I have always been a skill seeker, and again that has helped me in my life. I'll give you an example from my own life. When I was doing my senior residency in radiology, at that time in my college, musculoskeletal ultrasound was not being done. But I wanted to do it, but it was not being done. I wanted to acquire that skill. And I have always looked at world as a classroom. I always want to learn more skills. I found out a mentor, and I always recommend to all the children to find mentors. That I found a mentor who was teaching musculoskeletal ultrasound in Southeast Asia, and I went and did hands-on training with him. And then I came back, and even after my posting, when the radiology department would get over at around 5 p.m, I would call patients from OPD of rotator cuff tear and different shoulder pathologies, and I would try to do their ultrasound myself. That is hand skill. More you do, more you learn. But again, don't be a prisoner of your institute. That I have seen many students would say, sir, this kind of procedure is not done in my hospital. How can I learn? But world is a classroom. You need to find out an opportunity to learn somewhere else. You need to be proactive, because knowledge and skill will form your basis of your career. And the third component is often missed. It is like I would say I learned most of my medicine and the value of what medicine is when I had to go to a hospital in younger age as a patient's relative. Sometimes what happens is, as a doctor, you're looking at only one side of the story. You are a doctor, you are an authority, and there is a patient. But when you go to the hospital as a patient's relative, suddenly you are able to see the other side. The ability to understand the other side is called as empathy. Are you able to understand that you have a patient with malignancy, or you have a patient with a painful procedure? What does that pain really feel like? What does that malignancy feel like to the person who has a terminal illness, and how does it convert to the people in his family, and how does it really affects? I know that some of you medical students are right now young, and probably these words may not be easy for you to understand, but it is the third hidden component that sometimes we miss. We need to understand we're dealing with people, we're dealing with humans who are in pain and suffering, and that kind and empathetic attitude would always take you higher in the ladders of success in this career. Although I have today, tried my best to give you whatever I know about medical career, it is that you have to follow. It is not like I always knew all this. It is like I have made my own mistakes. So the words you say as a doctor in the hospital, they mean a lot, and that is where empathy and understanding always helps. I've made my own mistakes. Once I was in my hospital doing a barium study, and during the barium study, it was taking a lot of time, and it was around 4 p.m, 5 p.m. I had to go home. But in a barium study, you have to take a film at the ileocecal junction, and in this particular patient, it was getting delayed, and I was getting irritated, and I was telling the nurse that it is taking so long, I have to go. It is taking so long, I have to go. Finally, I took the X-ray and I went home. I forgot about it. A few months later, I was again posted in CT scan, and this time a young, thin-looking man comes to me and say, I am here for a CT scan. I said, what? I looked at his form, and he was a post-operative case of cancer of the colon. And I said, okay. I was discussing with the technician the plan of how we will do the study. This patient said, doctor, do you remember me? I said, I don't. He said, sir, I am the same person who was, taking too long that day. And that day I understood that as a doctor, the words that we are saying, even if we are not directly saying to the patient, they would remember it. So it is, I think the utmost important thing is that we need to know we are in a privileged position. It is a beautiful profession. It gives you everything that you need, and even much more than you need, it gives you a purpose in life. You need to be knowledgeable, you need to have the skills, that is for taken, but you need to be able to understand the other side. To the best of my ability, this is the best of my understanding so far. I'm still learning, but to the best of my understanding so far, this is the triangle that makes a great doctor.